Hello, welcome to today's episode. Today we will be talking about the effect of age on male fertility. So, it's a common knowledge or common belief that men can have children as well into their 60s or 70s, or some even believe men can have children as long as they live on this earth. Well, the oldest man to have had a child did so at age 96. So could there be some truth in that? We will talk about that in detail very soon. I am Christiana Mausi, a public health practitioner and a Fulbright scholar. Okay, so we all know that for women, there is a biological clock that is ticking as a woman ages. So as a woman ages, her eggs, the number of eggs that she has, begin to reduce. And that continues until menopause sets in, when it becomes difficult for the woman to conceive and have her own children naturally. Do men also have a biological clock that is ticking for them? What do you think? The answer is yes. Men have biological clock ticking for them, even though theirs may be a little less aggressive than that of women. So, as a man ages, and aging in this context, we are looking at men who are above 40 years. So once a man hits 40 years, there are certain changes that begin to occur in his fertility. So let's look at those effects. First, there is reduced testosterone level. And testosterone is the male hormone that controls sperm production. So if the cells that produce testosterone begin to reduce, it means the testosterone level will also go down. And once it goes down, sperm production also goes down. It reduces because this hormone controls sperm production. And if we have low sperm count or low amount of sperm, it means it will be difficult for pregnancy to occur. So it will be difficult for such a man to achieve pregnancy. The next effect is what? Poor sperm quality. So the man may have some sperms in the semen. Remember, the sperm is the cells that are within the fluid. So the entire fluid is called the semen. Within the semen, we have the sperms. So the sperms are supposed to have a natural or a certain appearance with the head, the middle section, and then the tail. In this situation, some of the heads, sperm heads may be bigger, larger than normal. The tails may be longer than they should. And if this happens, it makes it difficult for the sperms to swim up in order to fertilize the egg. So this will bring some reduction in the fertility potential of the man. Then our next point is delayed or fewer pregnancies. Obviously, once there is problem with the sperms, it means it will take a longer time for the man to be able to what? Achieve pregnancy, or to be able to impregnate his partner. So that is common as a man ages. Then our next point is increased risk of miscarriages and stillbirths. Stillbirth is just referring to the loss of the child or the death of the baby before or during the delivery process. So that occurs more frequent in men who are older. So what it means is that if the man is able to impregnate the woman, the pregnancy also suffers some risk or some effects, which are the miscarriage and then stillbirth. And also in older men, they have a reduced IVF success rate, which means even if the man wants to consider IVF as an alternative means of having his own kids, still there is a risk that there will be failure. The process may not be successful. Maybe it has to be repeated for a number of times for it to be successful due to the poor quality or poor health of the man's sperms. Then now let's look at the effects on the children of older men. So a child born to an older man, that is a man who is in his early 40s and above, is likely to have an increased risk of cancer. Typically, childhood cancers such as leukemia. Leukemia means cancer of the blood. The next one is what? Psychiatric disorders. Children born to older men are likely to have mental or psychiatric disorders such as bipolar disorder, schizophrenia. And in schizophrenia like this, there is that disconnection between the thought process, the emotion, and the behavior of the child. And this is a very serious mental disorder. The next one is behavioral or social function disorders. Typical example, these children are likely not to interact with other children. They tend to withdraw from other children, and they do not make friends. They are not able to maintain relationships, and they sometimes they talk at a very louder voice. So their social interaction, their social lifestyle tends to have some abnormality. The fourth point is that these children are likely to have inherited metabolic disorders. Examples include diabetes and other thyroid diseases. So in these children, because their father is older, it puts the child at risk of developing what? Diabetes. The next point is neurodevelopmental diseases. Typical example is autism, where some children are non-verbal, they are not able to communicate at all, and they have certain behavioral issues that the child will have to live with. They have learning disabilities, they have mental retardation, difficulty. It's really a tough effect on the child. So it tells us that indeed men have what? A biological clock which is ticking for them as well. So it is important that couples who are having challenged in conceiving should consider both the male and female component while seeking for fertility care. It's very important. Instead of focusing, typically, the focus is on the woman. We keep pushing the woman to seek care, seek help, and so forth. But it's important to include the man. So the man and the woman, husband and wife, should go and see the doctor for examination and treatment together. It improves the chances of them having children. Then just a quick one before we go. These days, it's very common to see men as they grow older. They tend to begin to take testosterone or steroids, medications, in order to boost their sexual performance. Well, when you take testosterone to boost your sexual performance, you will see a change in your sexual activity. You will have a stronger erection. You'll be able to stay on for longer hours. Fine. However, the negative part is that your sperm production will stop. Yes, because the moment you begin to take in an external hormone, testosterone, your testes stops producing the natural one. So you do not have any sperm production going on again because your body is not producing testosterone. So at the end of the day, you achieve an improved sexual performance. However, your fertility concerns become more or even worse. So it is important to seek medical care, seek the care from an expert, a physician, who may give you the testosterone replacement therapy, in addition to other hormones which will bring back the sperm production. So please avoid self-medication. Always seek help if you have any issue with your sexual performance or fertility. You can send your comments, your questions to my email, christiana.achu@fulbrightmail.org, or you can call or WhatsApp the number 050-174-2759. Thank you.